MRI is an imaging technique, something we use to look at the breasts, but increasingly we realise that it could be useful in women newly diagnosed with cancer where we weren't quite sure how big the cancer was or how extensive it was, to try to help us really tailor treatment to the individual. Within the MRI trial, what we're really trying to do is work out actually how useful is MRI? Does it really change that treatment pathway? And if so, in what direction? Does it actually mean that we have to bring less women back for repeat surgeries because we've missed some tumour? People who are eligible for this study are women for whom the treating team think that an MRI might alter their treatment pathway. Where conventional imaging with mammogram and ultrasound doesn't really show us the full extent of the disease, or where we're concerned that there may be other areas of disease in the breast that we simply can't see on a mammogram. This is more common in younger women where it's much harder to see a breast cancer on a mammogram, but also in women where they have very dense breast tissue where it's hard to see the extent of a tumour. MRI often shows that picture much more clearly, and you can have a much clearer picture of the full extent of the tumour. What we're hoping to be able to show is actually how useful MRI is, and then we'll be able to get the government to actually fund this. The governments don't want to fund lots of new tests if they're not shown to be useful, and of course if they're not shown to improve patient outcomes. The trials that we do are that kind of research that translates directly into better survival and better outcomes for women. So I guess you could say that trials really do save lives.